Up until recently, CMS, the Centers for Medicare and Medicaid Services, had a waiver that said, hey, we will pay for hospital level care in the home. And this was a huge boon to hospital at home services because it does two things. One, it opens up access to patients who have Medicare, but also private insurers take a lot of their lead from what's happening with CMS. And so, does this make private insurers a little bit more comfortable with this service or think this is a service we should be funding? And programs really took this and ran with it and said, this is something we wanted to do anyway. Now we can get funding because unfortunately, if there's no funding, we can't do things, right? We can get funding, we can meet our patients where they are, we can grow these programs. And a lot of hospitals invested a lot in growing the programs. And also, there were private programs that were grown as well. But unfortunately, that waiver had to be renewed by Congress. And when Congress did not renew that waiver, that funding kind of immediately went away. And so now you have people who had access through Medicare suddenly not having access. So what did that mean? Well, in the short term, that meant that programs really had to figure out what they were going to do with those patients, right? They were hospital level patients. They needed to be cared for at a hospital level. If you could no longer do that in the home, were we bringing them back into the hospital, which I've heard some programs did like pretty quickly say, hey, let's bring these patients back in. Or, were they kind of iffy that it was going to get renewed and sort of phased out certain parts of the program, allowing patients to slowly come back into the hospital. So there was a short-term, thought process of what do we do with these hospital level patients who are at home and how do we go from there? But then programs really had to start rethinking how they were going to either continue delivering care or what changes they were going to make now that that funding had dried up.